A silent threat. 8 signs that could indicate high cholesterol. High cholesterol, also known as hypercholesterolemia, is a subset of hyperlipidemia, which occurs when the body's lipid balance is disturbed, leading to significant health implications. Typically, lipids, including cholesterol, play essential roles in various bodily functions, such as forming cell membranes, hormone production, and assisting in fat digestion. However, when lipid concentrations increase beyond normal levels, it signals a shift toward potential health risks. This condition, hyperlipidemia, is marked by elevated amounts of fats, cholesterol, triglycerides, and their transporters, lipoproteins, highlighting a critical issue within the broader category of dyslipidemia. Dyslipidemia refers to elevated cholesterol or fats, also known as lipids, in the blood. Dyslipidemia increases the risk of clogged or hardened arteries, known as atherosclerosis, as well as heart attacks, strokes, and other circulatory conditions. Hyperlipidemia, and particularly its subset hypercholesterolemia, or high cholesterol, affects millions globally, yet misconceptions persist due to cholesterol's dual nature. While essential in appropriate amounts, excessive cholesterol, especially in certain forms, poses health risks. Effective management of high cholesterol often involves lifestyle modifications, and, in some cases, ongoing medication to regulate blood lipid levels. Lipids travel through the bloodstream within lipoproteins, varying in size and density, influencing their function and impact on health. Low-density lipoprotein, LDL, often labeled as bad cholesterol, carries cholesterol to tissues and can lead to plaque buildup in arteries, increasing the risk of heart disease and stroke. Conversely, high-density lipoprotein, HDL, known as good cholesterol, plays a protective role by returning cholesterol to the liver for excretion, thus reducing disease risk. Disruptions in this delicate balance, such as elevated LDL or low HDL levels, can lead to atherosclerosis and escalate the risk of cardiovascular diseases. Managing high cholesterol is essential in maintaining overall health and mitigating associated risks. Symptoms. Early stages of high cholesterol may not present noticeable symptoms, but as the condition progresses, the following signs may become apparent. 1. Xanthomas and Xanthelasmas. Individuals with severe or genetically predisposed forms of high cholesterol may develop xanthomas, which are fatty deposits that appear as yellowish-orange bumps under the skin or around the eyelids, known as xanthelasmas. These deposits result from the accumulation of lipids, particularly cholesterol, in the skin's layers. Xanthomas are the body's attempt to remove excess lipids from the bloodstream. While generally harmless, their presence can indicate significant lipid imbalances and may prompt further medical evaluation and intervention. 2. Corneal Arcus. Another visible sign of high cholesterol can be corneal arcus, which is a gray or white arc visible around the cornea of the eye. Although more common in older individuals, corneal arcus can also occur in younger people, and may indicate high cholesterol levels. Corneal arcus develops when cholesterol deposits accumulate in the cornea, the clear outer layer of the eye. While corneal arcus itself does not typically affect vision or cause symptoms, its presence can signal underlying lipid imbalances and may warrant further investigation to assess cardiovascular risk factors. 3. Leg cramps, mostly in your calves. Leg cramps, a common symptom of high cholesterol, often occur due to reduced blood flow to the muscles in the legs, primarily the calves. This reduced blood flow stems from atherosclerosis, a condition where cholesterol and fats build up along the walls of arteries, causing them to narrow. When arteries supplying the leg muscles are narrowed, they fail to deliver an adequate amount of oxygen and nutrients to the muscles during activity. As a result, the muscles may experience oxygen deprivation, leading to cramping sensations. These cramps typically occur during physical exertion, when the muscles require more oxygen to function properly. 4. Pain in your feet or toes. Similar to leg cramps, pain in the feet or toes can also be attributed to reduced blood flow due to atherosclerosis in the arteries supplying these areas. The narrowing of these arteries limits the amount of oxygen and nutrients reaching the tissues of the feet and toes, resulting in discomfort or pain. This pain may worsen with activity or prolonged standing, as the muscles and tissues in the feet require increased blood flow to support movement and function. 5. Chest pain. Chest pain, known as angina, is a hallmark symptom of coronary artery disease, a common complication of hyperlipidemia. Atherosclerosis in the coronary arteries, which supply blood to the heart muscle, narrows the passageways through which blood can flow. During physical exertion or periods of stress, the heart requires more oxygen-rich blood to meet its increased metabolic demands. However, narrowed coronary arteries may not be able to supply sufficient blood to the heart muscle, leading to a lack of oxygen and nutrients. This mismatch between oxygen supply and demand manifests as chest pain or discomfort, typically felt in the center of the chest or beneath the breastbone. The pain may also radiate to the arms, shoulders, neck, jaw, or back. 6. Trouble breathing or shortness of breath when you're active. Shortness of breath, particularly during physical activity, can occur when narrowed arteries limit blood flow to the heart or lungs. With high cholesterol, atherosclerosis may affect the coronary arteries supplying blood to the heart, or the pulmonary arteries transporting blood to the lungs. Reduced blood flow in these arteries impairs oxygen exchange, making it difficult for the body to meet its oxygen demands during exertion. As a result, individuals may experience breathlessness, chest tightness, or a sensation of being unable to catch their breath while exercising or engaging in strenuous activities. 7. Confusion or trouble speaking. These neurological symptoms can arise if a stroke occurs due to atherosclerosis in the arteries supplying blood to the brain. A stroke, also known as a cerebrovascular accident, occurs when blood flow to a part of the brain is disrupted, either by a blockage, also known as an ischemic stroke, or the rupture of a blood vessel, also known as a hemorrhagic stroke. When brain tissue is deprived of oxygen and nutrients, it becomes damaged or dies, resulting in neurological deficits such as confusion, difficulty speaking or understanding speech, weakness, or paralysis. The specific symptoms experienced depend on the location and extent of the brain injury. 8. Weakness, often in your arms. Weakness, particularly in the arms, can be a consequence of stroke resulting from reduced blood flow to the brain. When a stroke occurs, the affected area of the brain may be unable to send signals to the muscles, leading to weakness or paralysis in specific regions of the body, such as the arms. This weakness may be accompanied by other neurological symptoms such as numbness, tingling, or loss of coordination. The severity and duration of weakness depend on the size and location of the stroke, as well as the extent of damage to the brain tissue. These physical manifestations, although generally benign, serve as visual indicators of potential underlying health risks associated with high cholesterol. Their presence underscores the importance of regular health screenings and proactive management of lipid levels to prevent complications such as cardiovascular disease or strokes. Early detection through lipid panel tests allows for timely intervention and risk reduction, emphasizing the significance of heightened awareness and proactive health management in individuals at risk for high cholesterol. Causes of high cholesterol. High cholesterol can affect individuals from various walks of life, but certain factors can increase the likelihood of developing this condition. 1. Diet. What you eat plays a significant role in determining your blood cholesterol levels. Foods high in cholesterol, saturated fats, and trans fats can elevate your lipid levels. These include items such as cheese, egg yolks, red meat, fried and processed foods, ice cream, and pastries. Consuming these foods regularly can contribute to an increase in blood cholesterol, thereby predisposing you to high cholesterol. 2. Lifestyle. Certain habits and lifestyle choices can also influence the development of high cholesterol. Individuals who smoke, drink excessively, are overweight, lead sedentary lifestyles, or experience chronic stress are at a higher risk. Smoking and excessive alcohol consumption can adversely affect lipid metabolism, while obesity and physical inactivity can lead to weight gain and alterations in cholesterol levels, particularly reducing HDL cholesterol and elevating LDL cholesterol. 3. Medical conditions. Various health issues can impact cholesterol levels and contribute to high cholesterol. Conditions such as diabetes, liver disease, pancreatic disorders, multiple myeloma, polycystic ovary syndrome, PCOS, hypothyroidism, lupus, kidney disease, sleep apnea, HIV, and primary biliary cholangitis can disrupt lipid metabolism and lead to elevated cholesterol levels. Individuals with these conditions may require careful management of their lipid profiles to reduce the risk of cardiovascular complications associated with high cholesterol. 4. Medications. Certain medications prescribed for other health conditions can affect cholesterol levels and contribute to high cholesterol. Drugs such as steroids, beta blockers, diuretics, hormonal birth control, and antiretrovirals used in HIV treatment may influence lipid metabolism and lead to dyslipidemia. It is essential for individuals taking these medications to monitor their lipid levels regularly and work closely with their healthcare providers to manage any adverse effects on cholesterol levels. Screening regular checkups to test for high cholesterol are really important, especially for people with family members who've had it or heart problems. Cholesterol levels are measured in milligrams per deciliter, and normal is less than 200 milligrams per deciliter. If your levels are between 200 and 239 milligrams per deciliter, it's considered borderline high, and if it's 240 milligrams per deciliter or more, it's considered high. These tests, recommended every few years for adults, measure different types of cholesterol in your blood, and by doing these tests, healthcare providers can find out if you're at risk early and help you avoid heart problems down the road. Prevention. Preventing high cholesterol effectively involves adopting healthier lifestyle habits. Key among these is ceasing smoking due to its adverse effects on lipid levels and heightened cardiovascular disease risk. Reducing saturated fat and alcohol consumption is crucial as both elevate lipid levels. Embracing a diet abundant in fruits, vegetables, and whole grains is beneficial for cholesterol management and overall well-being. Maintaining an optimal weight is vital in preventing high cholesterol. Excess weight, especially around the abdomen, correlates with increased LDL, or bad cholesterol, and decreased HDL, or good cholesterol levels. A combination of nutritious eating and consistent physical activity can aid in weight loss, thereby improving cholesterol profiles and mitigating risk of high cholesterol. Lifestyle modifications. For those diagnosed with high cholesterol, management focuses on healthy weight maintenance through a balanced diet, portion control, and regular exercise. Generally, here are the measures vital in minimizing complications from high cholesterol. 1. Healthy diet. Adopting a balanced diet with portion control is crucial for managing high cholesterol. This involves consuming a variety of nutrient-rich foods such as fruits, vegetables, whole grains, and lean proteins, while limiting saturated fats, trans fats, and cholesterol. Emphasizing foods high in soluble fiber like oats and legumes can help lower LDL cholesterol levels. 2. Regular exercise. Engaging in regular physical activity is essential for improving lipid profiles and overall cardiovascular health. Activities such as brisk walking, jogging, swimming, or cycling for at least 150 minutes per week can raise HDL cholesterol, lower LDL cholesterol, and reduce triglyceride levels. Exercise also promotes weight loss and helps maintain a healthy body weight, which is beneficial for managing high cholesterol. 3. Medication. In cases where lifestyle changes alone are insufficient, medications may be prescribed to lower cholesterol levels and reduce the risk of cardiovascular events. Depending on a person's specific health requirements and risk elements, different types of treatments could be considered to achieve the desired cholesterol levels. To learn more about this and other common illnesses, please like this video and subscribe to Curativity. Thanks for watching, and until next time, take care.